and welcome to the Code Clarity podcast. I'm Jean.
And I'm Rena. And today we are talking about medical education and whether it should allow the mention of medicine. So some of you will know that the current code under clause 1.17 doesn't actually mention medical education, but does refer to the fact that non-promotional education mustn't allow the mention, direct or indirect, of any medicine. And traditionally, we've always bucketed medical education under that. But Jean, we did a poll recently. Why don't you tell everyone about that?
Yeah, so we asked on LinkedIn if what people would want to see changes to the code in regards to medical education and its definition. And there was almost 200 people voted, and 68% wanted medical education to be able to mention product, or at least to be able to mention drug class during it. And this is something that we hear that is allowed in other countries. It's a very common complaint from Global when they're working with the UK about, MedEd, we're allowed to mention products in other companies if we're doing it under medical. And obviously the IPHA code. So it's the IPHA code does allow it to happen, but actually when you look at the definition, it's similar to. It doesn't actually say whether you can or can't mention medicines. It's not that specific. It's just the interpretation of how the code's applied that allows it to happen. So yeah, it's. I see a lot of advantages. I understand why people want medicines or drug class to be used in MedEd. I think there's a huge amounts of benefits to it, and I think, Rena, we talked to some people about how they've seen it playing out in practice, didn't we? Do you want to share how they thought it could work?
The benefit for us is, of course, we know how people voted. So we contacted some of those 68% that wanted mention of medicine. And this is the kind of stuff that they were saying. And all of it is completely bona fide. So they were saying, look, there's a real lack of knowledge of some disease areas, and it's simply insufficient to talk about symptoms and diagnosis without some sort of mention of available treatments and pathways. They also said it's really suspicious when a pharma company does MedEd and then says to an HCP, oh, but we can't talk about any data around any medicines. Because they don't really understand the code requirements. In fact, I would argue that some of the MSLs who are the front line doing the MedEd don't necessarily understand the code requirements as well. And so the overall feeling is MedEd is actually quite unbalanced if it is only talking about symptoms and diagnosis and prognosis without the overall picture of treatments and pathways as well. So we are left with a bit of a quandary with, we can see lots of pros, but there are possibly a few cons with respect to MSLs, Jean?
Yeah, well, for me, it's that whole, how do you draw the line between when is it MedEd mentioning medicines and when does it fall over into promotion? And at the moment, we know that the benchmark, if you like, of promotion is quite low. So we know through code rulings that if you, in some cases, if you just mention drug name, if it's really well known, but otherwise, usually if you mention a couple of attributes about the drug, or you talk about the drug class and something else, you're seen as promoting. There's obviously been cases where MSLs have talked about medicines proactively, not reactively, and that's been ruled to be promotional, and that they would be then thought to be doing, a promotional activity. So I think it's hard at the moment, given the application and the interpretation of what promotion is, to see how you could do that in practice, and what criteria would we need to put in place to say, no, in this case it's medical education, and in this case it's promotion.
Mm-hmm. Okay, so in summary, what we are saying is the current code doesn't allow mention of medicine in MedEd. Secondly, we absolutely know lots of people want this. But thirdly, having looked at the pros and cons, you and I as experts see a lot of difficulties in the practical implementation of how MedEd could allow this, particularly for field-based MSLs. Would that be true?
Yeah, I think it's something that needs a lot of thought and a lot of clear guidance on.
Clarity. Okay, thank you, Jean.
Thanks a lot. Bye.